So, my name is Annabelle, and I'm here together with Professor Dr. Nazima Idris, who is the Medical Director of IMU Healthcare, as well as a consultant obstetrician and gynecologist in our medical clinic. So, welcome, Prof. Nazima.
Thank you. Thank you very much, Belle.
No worries. How are you feeling today?
I'm good and very happy to be here with you today to talk about cervical cancer and how not to get it.
Yeah, definitely. I'm excited about that too. So now Prof. Nazima is definitely no stranger to us. She's been on, this space for quite a number of times. However, for the sake of our new viewers or any new viewers that we may have, do you mind introducing yourself to our audience, Prof. Nazima?
Okay, thank you very much, Belle. To the audience, my name is Nazima Idris. I'm a consultant obstetrician and gynecologist, and I've been one for over 20 years, which means I've been looking after women's health since then, including patients with cervical cancer.
Thank you so much, Prof. And wow, 20 years. I'm sure with your knowledge and your years of experience, there's a lot that we are able to learn from you today. So, a very kind reminder to the audience before we start that if you have any questions at all about cervical cancer or HPV vaccination, don't hesitate to leave it in the comments below, and we will ask Prof. Nazima's opinion about it a little later during our Q&A session. So now, Prof, would you mind telling us a little bit about cervical cancer and what it is?
Yeah, it'll be a pleasure, Belle. I want to show you a picture of the normal cervix and the cervix with cancer. Can we have that picture shown?
Yeah, I think that it would be really
Okay.
interesting to see the contrast.
Yeah. So if you can see the picture on your screen, the one on your left is how a normal cervix looks like. And it's very smooth, very pink. And you can see the one on the right is very different. Right? It looks quite nasty. This is one of our patients that we have diagnosed with cervical cancer just some months ago. So from the nice normal cervix to cancerous, actually it takes quite long because cancer cervix develop very slowly. I would probably want you to know that at this point in time, cervical cancer is a very important cancer for us to know because it is the third commonest cancer in this country among women in Malaysia. And every year, about 2,000 or close to 2,000 women are newly diagnosed. These are the new cases who was diagnosed with cervical cancer. And every year also, close to 1,000 women died from cervical cancer. Right? That's a huge number, and in this modern time, we should not have to see this kind of statistics anymore. Okay. So a few other things about cervical cancer. This cervical cancer, it has a pre-cancer stage. It doesn't just become cancer right away from normal to cancer. It has a pre-cancer stage. And do you remember, or if you know of the pap smear? Pap smear is the test that we do to detect, hopefully we want to detect the pre-cancer stage. If you do a pap smear, it comes back as normal. That is good. You only need another pap smear in 3 years. If it comes back as a pre-cancer state, it is good also because you can treat the pre-cancer state and you will not get into the cancer stage. So that is the idea. Okay. But the problem with pap smear is, although we have been offering it since the 1960s, so that would have been what, 70, 60 years ago, 60 years ago? Yeah. Not many women came to get the test done. In the last health survey that was done, only about 20% overall women that has actually came to get the test. So that strategy does not seem to be working very well for us in reducing the cancer of the cervix. So if we don't do pap smear, we cannot detect the pre-cancer stage, then we will not be able to catch it in time. So we have to think of a new strategy because doing pap smear for 60 years, it does not seem to be able to reduce cancer of cervix in our women here in this country. So I want to introduce you to a virus. If you can show the picture of the virus.
Yeah, virus is a term that we are all not foreign to.
Okay, very familiar with viruses now. Okay, this is a a picture of the virus. It
Mm.
is called human papillomavirus. Might look very nice on the picture,
Yeah.
but it's actually a very nasty, very dangerous kind of
Mm.
virus. It's called human papillomavirus, or for short, we call it HPV. Okay, so there are a lot of HPV subtypes. Some are not going to cause cancer in you, but some will lead to cancer in you. It causes changes in your cells, and it will lead to your cervical cells becoming cancerous. So because we know of this, we have developed vaccine to prevent, to protect ourselves from getting the cervical cancer. Just like you're getting your vaccine for COVID, right? To protect
Mhm.
yourself against the infection. The principle is the same. If you were to take the vaccination towards a certain type of dangerous type of the HPV, it will protect you against cervical cancer. And that is why if you have children, or if you're a young person yourself, you would have remembered when you were in secondary school, you were given HPV vaccine. You would have received 2 shots of it. So this is the purpose, because we want to prevent or protect you against cervical cancer.
Yeah, I think that's really, really important, especially since that you've mentioned that cervical cancer is the third highest in Malaysia
Yeah.
among women, and that's a huge number. And to think that all that could be prevented by a vaccination, and we could actually lower that number down is astonishing. So, because I think this is so important. Prof, do you mind just translating this information as well
Yeah.
in BM for our audience as well?
Okay, sure. Okay, so pada hari ini kita akan bercakap tentang kanser cervix atau kanser pakar rahim dan bagaimana cara untuk kita melindungi diri kita daripada mendapat kanser pangkal rahim atau kanser cervix. Pertama sekali, saya ingin, dah tengok gambar tadi, right? Dah tengok gambar tadi. Jadi saya nak ulang sekali lagi yang kita masih belum menang dalam menangani kanser cervix di kalangan wanita Malaysia, sebab setiap tahun sekitar 2,000 kes baru yang kita diagnose. So maksudnya 2,000 wanita setiap tahun didapati mendapat kanser cervix. Dan juga daripada 2,000 ini, hampir 1,000 menyebabkan kematian. And itu ialah satu yang sangat sedih lah, ya. Dan jika kita tahu tentang kanser cervix, kita juga tahu bahawa kanser cervix ini dia ada satu peringkat pra-kanser. The peringkat pra-kanser ini kita boleh kesan. Kalau anda pernah dengar tentang pap smear ialah ujian yang kita buat untuk mengesan peringkat pra-kanser. And jika kita ada peringkat pra-kanser, dan kita boleh merawatnya. Okay. Lagi satu yang kita tahu ialah kanser ini disebabkan oleh sejenis virus yang dipanggil HPV, Human Papillomavirus. And bila kita faham virus ini menyebabkan kanser, kita juga telah ada satu vaksin untuk melindungi diri kita daripada mendapat kanser cervix. Jadi seperti mana juga vaksin COVID-19 yang kita telah bincangkan sebelum ini, vaksin untuk HPV juga akan melindungi kita daripada HPV virus ini dan melindungi kita daripada mendapat kanser cervix.
Right, thank you so much, Prof. Nazima, and I'm glad we got to understand a little bit better on the danger of the HPV virus. You're right, it does look very pretty, but of course we know it brings about a lot of danger as well, especially when unvaccinated or that we don't take care of ourselves. Now, for our next section, we will be going through, various different types of misconceptions or myths about the HPV vaccination that we would like to address. So the very first one that is a common misconception is that people would think that vaccination doesn't help prevent cervical cancer. Prof, do you have any thoughts on that? Also, I noticed that we have gotten a few different comments that we have with certain question, and thank you guys so much for inputting your comments. Please do give as many comments and questions that you have, and we will add them into our Q&A later on at our Q&A portion towards the end of this portion. But yeah, if you have any myths or any ideas or things that you would like to iron out with any uh, facts that you've heard, like my mother said this or my doctor have said this, feel free to put in the comments and we'll also address it within this myth debunking portion of this section. So yeah, Prof, vaccination doesn't help prevent cervical cancer. Do you have any thoughts?
Okay, that's definitely not true.
Mm-hmm.
Because it has been proven that vaccine prevents cervical cancer, and we have a lot of data to support that. It works. How it works is, if you take the vaccine, you will introduce your body to the particles of the virus, and with that exposure, your body will produce antibody to the virus. And when you get the real virus coming into your body, this antibody will fight it, so that virus cannot cause harm to you. So that is not just theoretical; it has already been proven by large data that we have so far.
Yeah, and I heard as well that like because this misconception has come from the fact that, oh, the vaccination only helps certain strands of HPV but not all. So do you have any thoughts as, like, with the current technology and medicine that we have now, does the vaccination now cover a wider strand with a greater sense of protection?
Yeah, okay. Very good point, Belle. We know of all the HPV subtypes or HPV types, about 14 of them actually cause cancer. And there are a few types that cause much more cancers than the others. So if you remember the vaccine that you get at school, actually it has two types it is actually a vaccine against two types of virus, okay, the 16 and 18. Um, and there is also another vaccine that has the protection against HPV 6, 11, 16, 18.
Mm-hmm.
These different types of HPVs, it cause the 6 and 16, 6 and 11 cause warts, not cancer. It can cause warts in women and can cause warts in men also around the genital area. 16 and 18 actually is responsible for about 70% of cancers. So that's 70%. And we know we have about 14 types that can cause cancer. The later vaccine has 7 more, or it has total of 9 protection against 9 viruses, 2 that cause warts, and 7 that cause cancer. And that gives you up to 90% or over 90% protection. So different vaccine has got different level of protection.
I see. That's great. That's really, really great to know that up to, like, 90% of wide variety has been covered in the vaccination. So just now you mentioned men also could get these like warts and everything, right? So that brings us to the next myth that is available, which is only girls should get the HPV vaccine and boys don't need it.
Yeah, it's a myth. Because you see, it works like this. We give vaccine to the girls, it protects the girls against the virus, so they don't get the cancer. But there are some girls who cannot receive the vaccine, mostly for health reasons, okay? And they normally get the virus from the sexual partner, the boys. So if we were to vaccinate the boys, then they will not have the virus in their body, then they cannot transmit it to the girls. So it's like a double protection. You have your protection, and there's an additional layer of protection where your partner will not give you the virus. So boys should be vaccinated also. I know in the Malaysian health system or school system, only the girls are vaccinated, but overseas, both boys and girls are vaccinated.
I see. That's really, really interesting. So we know that, both boy and girl could, like, potentially transmit the HPV. So this is a thought that, what if I only had one sexual partner? That means I would never get HPV then,
Yeah,
because
yeah,
that one is not infected, so I won't be
yeah.
infected, right? Yeah.
That's right. We know the more sexual partner you have, the higher is your risk of getting HPV infection, the higher your risk of getting cervical cancer. If you have only one partner, then your risk is reduced, but it is not zero. It is not zero because your one partner could be the one who transmit the viruses to you. So even if you only had one partner, we cannot be we cannot feel too safe that we're not going to get the cervical cancer, because in our experience, the patients that we have seen, they only have one sexual partner. Okay, but they still get the infection. Yeah.
I see. Yeah, that's really, really surprising that even though with one, you could still contact HPV, the virus.
Yeah.
So the very fact that you had one sexual partner, that doesn't mean that you are completely immune to
Exactly.
HPV. Yeah, so I think that's a really good amount of information. Do you mind just summarizing that in PM for us as well?
Okay. HPV virus ni dia boleh menjangkiti kedua-dua wanita dan lelaki. And wanita selalunya mendapat HPV virus ini daripada pasangan seksual mereka. Jadi kalau kita memberi vaksin kepada wanita, dia dapat melindungi diri dia daripada virus dan seterusnya tidak mendapat kanser cervix. Tetapi ada wanita yang tidak boleh menerima vaksin di atas sebab-sebab kesihatan. Jadi kalau kita juga memberi vaksin kepada the boys, lelaki, bila mereka mendapat vaksin, mereka tidak akan mendapat jangkitan HPV. Bila mereka tak dapat jangkitan HPV, mereka tidak akan menjangkiti pasangan wanita mereka. So dia seperti perlindungan yang berganda untuk wanita, dan ditambah lagi dengan pasangan seksual mereka juga tidak memberikan virus kepada mereka. Okay. Dan soalan yang lagi satu ialah Bel? Okay, jika ada satu sexual partner saja. Okay, orang yang ada satu sexual partner sahaja, risiko untuk mendapat virus dan kanser kurang daripada orang yang mempunyai lebih ramai sexual partner atau pasangan seksual. Tetapi dia tidak memberi perlindungan sepenuhnya, sebab perhubungan seksual dengan satu partner saja sebenarnya telah cukup untuk menjangkiti jika pasangan itu ada virus yang boleh menyebabkan kanser cervix. Jadi walaupun kita kata kita cuma ada satu pasangan saja dan pasangan kita kata dia ada satu pasangan saja, adalah lebih baik untuk kita ada perlindungan dengan vaksin.
All right, thank you so much, Prof. So I hope that was really helpful to everybody. So now on to our next myth is that HPV vaccination can lead to infertility.
Okay, the answer is no. The vaccine does not disrupt your process towards getting pregnant. It doesn't cause you not to ovulate. It doesn't cause any problem to your pelvic organs. So the simple answer is no, it does not lead to infertility.
Thank you so much, Prof. So now we're going to go into a portion that's slightly more sensitive but necessary nonetheless. The next myth that we have is that one should only get the HPV vaccine when they have started sexual activity.
Okay, good point. But it's a myth, because to see how vaccine works is it protects you from the virus. It makes your body prepare for if the virus comes, it can fight the virus and it can kill the virus. If you already have a sexual activity, you could have already been infected with the virus, and that virus could have started to cause problem to your cervix, and the process of becoming cancer has started. So giving vaccine after that is not useful anymore. So that is why we are vaccinating our school girls, because we are assuming they will not yet be exposed. So age 13 to 15 that we are the school girls that are vaccinating now. This is with the assumption that they are not yet exposed, and therefore they can get the protection. The later we vaccinate, especially if you have already been exposed, the less protection you can get.
Yeah, I think that's the common idea with vaccination is the fact that it's not a cure, but rather it's a form of protection.
Yeah.
And that's why you get it before you even start any form of sexual activity, because in case you are exposed to the HPV, your body already has the antibodies to fight the virus if you are in contact with it. So that's why it is so important to get the vaccination prior to starting any sexual activity, not wait until after you've started and then only going to get the vaccination. Am I right, Prof?
Yes, exactly. That's correct.
Yeah. So we on to the next one, which is getting the HPV vaccine will encourage adolescents to be more sexually active, and therefore they will be more susceptible to sexual transmitted disease or STDs.
Yeah, it's an extremely important point. Thank you for bringing that up. When we started the program to vaccinate the schoolgirls, these are the things that was being discussed. That will this lead to them becoming more promiscuous and more exposed? Because the thinking was that if the girls know that they are not going to get cancer because they're already vaccinated, and they will be less careful in exposing themselves. So it's actually a very valid concern, not just here in this country but elsewhere. To address this concern, there's one large trial in Canada. About 200, over 200,000 girls were studied. Half of them received vaccination, half of them did not receive vaccination at that point in time. And the result was that they did not find any increase in sexual indicators or increase in unsafe sexual practices that leads to pregnancy in those who were vaccinated compared to those who were not vaccinated. So at this point in time, we are happy to conclude that giving vaccination is not going to cause them to be more susceptible to sexual transmissible diseases or other adverse sexual behavior. So it is actually not warranted. So we, as parents, we should not worry about that.
Thank you so much, Prof, for that clarification. I think that is extremely important for everyone to know. Yeah, and I think that that concept or this myth is actually one of the biggest reasons why parents are not keen to get their children vaccinated. It's because they are worried of their children becoming a bit more sexually active because they believe that they may be safe. But it's good to know that we have scientific evidence to see that that may not necessarily be the case. And because this is so important, Prof, do you mind just saying this again and translating it into PM for our audience here?
Yep, okay, sure. Ada satu kerisauan di kalangan ibu bapa yang kalau kita memberi vaksin HPV kepada anak-anak, dia akan membuatkan mereka merasa okey untuk terlibat dalam aktiviti seksual, kerana sekarang mereka tahu bahawa mereka tak akan mendapat jangkitan HPV dan mendapat kanser. So itu ialah kerisauan yang menyebabkan keluarga risau, patutkah kita memberi vaksin kepada anak-anak. Tapi kerisauan ni sebenarnya bukan berlaku di Malaysia saja, di negara-negara lain juga. Dan ada satu kajian yang besar yang melibatkan lebih 200,000 adolescent atau wanita yang muda, teenagers, okay, yang menunjukkan bahawa grup yang menerima vaksin tidak mempunyai kelakuan seksual yang mendatangkan risiko berbanding dengan grup yang tidak menerima vaksin, sama saja. Jadi adalah tidak betul untuk mengatakan kalau kita memberi vaksin kita akan menyebabkan anak-anak ni akan melibatkan diri dalam kelakuan seksual yang membahayakan diri mereka. Jadi kita tak perlu risau tentang itu. Tentang keadaan di Malaysia, kalau anak-anak ini perlu mendapatkan vaksin, ibu bapa mesti memberi consent. Jadi kita bila kita melihat data, sebenarnya kebanyakan majoriti ibu bapa tidak ada masalah untuk memberi consent, persetujuan untuk anak-anak mereka mendapat vaksin. Data yang kita ada menunjukkan 98-99% ibu bapa setuju untuk anak mereka diberi vaksin untuk mendapatkan perlindungan dari jangkitan HPV dan cancer of the cancer cervix.
Thank you so much, Prof. That was a lot of information. We are so glad to have you to be able to give a larger, wider translation so that most people, everyone here understands exactly how important vaccination is to prevent cervical cancer. So now we're moving on to the next myth or misconception, which is HPV is uncommon and it's unlikely that I will be infected, so therefore there is no need to get vaccinated.
Okay, that's another myth, as you have said, because HPV is very common. Actually, in a lifetime, about 80% of people will get infected. So it is actually we cannot say it is not common. We are not likely to get it. It is very likely that we are going to get it. It's just that we don't know whether you're getting the one that type that caused cancer or the one that did not cause cancer.
Wow, that is a large number. 80%?
Yes, that's right. 80% in a lifetime.
Wow, 80% possibility of contacting HPV virus. That's insane. Yeah, can see the increasing alarming importance of getting the vaccination in order for us to get protected.
Yeah.
So now, the last myth that we have here, it says instead of getting a vaccination, I can just go for a pap smear every year. Yeah, do you mind shedding a bit of light on the difference between vaccination or a pap smear
Yeah.
and whether either or together? Mm.
Okay. So we have been doing pap smear. If you remember what I said before, we have been offering pap smear since the 1960s, and 60s to now is 60 years, if I get my mathematics correct. And it has not been successful in reducing cervical cancer. Some group of population will have pap smear every year, although it's not necessary. You only need it every 3 years. Some group of population did not have not had pap smear ever. So there's a big discrepancy in that. And pap smear does not work the same way as a vaccination. Pap smear works by detecting if the cancer is there or is happening or at the pre-cancer stage. So with pap smear, we wait. We wait and see whether do we have it or do we not have it. And hopefully when we do regular pap smear, we can detect at the pre-cancer stage so it can be treated. Okay, but it requires treatment. HPV goes a step before that, which means it prevents you from getting the infection. It prevents the infection from causing harm to you. So so it's like you're doing something active in trying not to get cancer and not just wait to see if it's going to happen and pick it up early. So that's the difference between that. So if you say, I'm just going to do a pap smear every 3 years, that will give you some protection. But if you have a vaccination together with the pap smear, then you have a much better protection. Remember, if you have had the vaccine, actually you still need a pap smear because we vaccinate you against at the maximum 7 viruses types. And you know there are 14 virus types that can cause cancer, although the other 7 is probably is not will not cause a lot of cancer because a lot of cancer, 90% is actually caused by these 7 types that we already put in the vaccine. Okay, so the way to go is ideally in an ideal world, you get the vaccine when you're very young.
Mm-hmm.
Can be given as early as 9 years old actually, but normally we do it at school about 13. Get your HPV vaccine. And once you have started your sexual exposure between the age of 21 to 29, do your pap smear every 3 years. Once you have reached age 30 to 64, you can do HPV vaccine together with pap smear. If you don't have the you do HPV testing. If you don't have the HPV and your pap smear is normal, you can repeat in 5 years. So it does not need to be so frequent. And the best, you can either do HPV only. If it is negative, do HPV in 5 years. Or you can do HPV plus pap smear every 5 years. It's called co-testing, right? Okay. If at any time it is abnormal, another thing that you need to do that we can discuss if you want to know.
Yes, thank you, Prof. I think that's really great clarification where, pap smear is a lot of like detection and whereas the vaccination is more of like protection, if I could put it that way.
Yes, yes, it's perfect.
Yeah, thank you, Prof. I think that's really, really clear. You did mention there was age. You can get it as young as 9 years old, but a lot of
Yeah.
children may get it at 13 years old. What about after the age of like 12 to 13? Is it too late to get the vaccine? Would it be less effective in that sense?
Research has shown that if you receive it before the age of 17, it can confer good enough protection. I think the later you get it, the higher the risk of getting the infection already. That is why the effectiveness goes down. I think other countries vaccinate their kids, their children around age of 11, 12. There are countries that vaccinate as early as 9, and we vaccinate around 13 to 15. So anything below 17 is good. If you are later than that, but you are not yet sexually exposed, you can take the vaccine because you have not been exposed. Okay. If you have been exposed, then the story becomes a bit different. Do you want me to explain that now, or you want to reserve it until later?
Mm, I think we could get it a bit later because we do have a question about, whether unmarried women should have the HPV vaccination or do a pap smear. So I think we can leave it for that portion.
Okay, sure.
Right. So just one more question before we go into the public questions is that, if I got the HPV vaccination as a child, am I protected for life? Does that mean, I don't have to, yeah, I don't have to be afraid?
Yeah. It is confers lifelong protection. So if you get it before the age of 15, like what we're doing now, then you can take only 2 doses of vaccine. If you take it later, there will be 3 doses. But you don't have to worry about that. The doctor will advise you about how many doses do you need for the vaccination. Yeah.
All right. Thank you so much, Prof. And we hope that, the audience here has benefited from the little information that we have here. Actually, not a little, it's quite a lot. And it's fantastic. And we're so grateful to Prof. Nazima to give us a really detailed breakdown and explanation on cervical cancer, HPV vaccination, pap smear. All these things are important information in order for us to make better decisions for our medical care. So now we would like to open up the floor to anyone who would like to ask Prof. Nazima any questions. I already see we have a large amount of questions here and we're so excited to get into them. However, before that, please take this moment right now to also share this Facebook Live with your friends and family because this is a great opportunity to ask Prof. Nazima any questions in a way almost like a free consultation from one of our OBGYNs and ask the questions with regards to cervical cancer, sex, or HPV vaccination. So now we have the first question up here on the screen, and which is, "Hi, doctor. This is from Karen. How long the HPV vaccine shot need to be jarakkan after the COVID-19 vaccine shot, or do both vaccine can be given together?" I think this is a fantastic question, Prof. Do you have any thoughts?
Yeah, okay. You take the HPV vaccine, the COVID-19, I would say if you have not had your HPV vaccine and the more important, the critical vaccine to be taken is the COVID-19 vaccine first. I would suggest you complete the vaccine first because when you get the vaccination, there'll be some side effects. You may not be so well after that. I think you recover from that first. Then after that, you can get your HPV vaccine. So there is no specific time frame, but I think we look at it that way. Just get the COVID-19 vaccine, recover from the side effects, and get your HPV vaccine after.
So there isn't really a specific time frame, like
No,
2 weeks or a few months.
no.
Okay. All right, thanks, Prof. So the next question here, which is again related to timing, which is I think I've gotten my HPV vaccination when I was a child, but I don't remember. Should I take the vaccination again? I think this is a very relatable question. I know that
Okay.
like a lot of things, I don't even remember what I had for lunch yesterday. So let alone a vaccination or injection that I got when I was a younger teenage girl. So yeah, Prof, do you have any
Okay. Okay.
thoughts?
One, if it is as a child, if you don't remember, your mother might remember, so you may want to check with her. And we introduced HPV vaccine around 2010. So if you're in school, you're in lower secondary around that time, and you have received vaccination or jabs, 2 jabs, that could have been the HPV vaccine. If you have taken one, the protection is actually lifelong. So you don't have to take it again, right? And we normally, if you have your vaccination, there should be a card that is given to you to tell you that you have received the vaccination. If you're not sure whether you've really gotten it or you think you have not gotten it, then you can take the vaccine. But if you do, then you don't have to, because the protection is lifelong.
Is there any dangers to like getting it again? Like in case I did get it, but because I'm not sure I'm gonna get it again, is there any dangers of getting like
No,
double vaccinated?
no, it's not really.
Ah, I
It's
see.
just that it's not necessary.
Yeah, I was also calculating like 2010. I wasn't 13 when I'm 2010, so I probably was not around when the government mandated it. So yeah, must need to check with my mother if I did get
Okay.
vaccinated when I was younger. Right. So the next question that we have here is from Rina. Sabrina Rina. I'm not comfortable with pelvic exam. Is there another way to get tested without a pelvic exam?
Okay, I understand. A lot of people do not like this pelvic examination, especially when we put this instrument that we call speculum into the vagina and we want to look at your cervix in that. So if you're going to have a pap smear, there's no other way. A doctor has to do it, because we have to really look at your cervix and take the sample from the cervix itself. But if you're going to test for HPV virus only, you can do it on your own. You do not need to get the doctor to do the pelvic examination and take the sample for you. You can do it yourself. We can give you the kit and the instruction, and you can do it in at home or in the bathroom, because it will take sample from the vagina. I probably want to talk a little bit about the HPV test itself, okay? Because we talk about the virus and about checking whether the virus is there. So if you have been sexually exposed and you want to know whether you already gotten the virus before, uh, and you think if you don't have the virus, you want to take the vaccine. So this is where we do the HPV testing. So the sample that we take is from the vagina. So the doctor can do it for you, or if you're not comfortable, you can do it yourself. Get the kit, get the instruction, go to the washroom and take the sample yourself. That means you have to put this sampler up your through the vagina opening, go inside, and you have to sort of move it a bit so that it can sample the inside of your vagina, take it out, put it back in the kit, and give it to us. So it is not so very difficult to do. So if you don't want the doctors to do it because you're not comfortable, you can do it yourself. With that test result, we will know whether there's no HPV virus, you're clear, your risk of cervical cancer is very low, come back in 5 years. Or if it is positive for virus, then we will see, is this a high risk virus to cause cancer, or the low risk virus that is not going to cause you any harm. Then we can advise you accordingly. My patients say, I rather you do it. I don't want to do it alone because I might not do it right. But actually, you can do it. It's not too difficult.
Yeah, we actually have a very related question here from Amira. She said, like, how safe if we do the self-test kit? Will it hurt?
It shouldn't, because it is. You're going to put something that looks like a small stick or a small stick up to the vagina. You can gently put it up to your comfort. It shouldn't hurt because you are doing it yourself. It will give you instruction how deep you have to go, and the rotational movement that you have to make, so that we can get a good enough sample. It is
All
safe
right.
because you're not likely going to overdo it and injure yourself. No.
Yeah, I've heard someone say that if you feel any form of pain at all, that's when you're not doing it right. So maybe for yourself, if you're doing a self test kit, you would know best as well how to adjust because you are in full control of the amount of pain you're
That's right.
putting onto yourself.
That's
Yeah.
right.
So yeah, about these self test kits, right? Are they readily available? Where can one get a self test kit actually?
Okay. I would think you can even ask your GP if they have the test kit, and you can do it over there. If you go to your gynecologist, they should have it. And we have it here, if you want to have it done. So just ask your doctor first if they have the test kit.
All right, thank you so much, Prof. So now we have another question from Zam. If my PEP test or HPV test is abnormal, what do I have to do next? Really great question, Zam.
Yeah.
So yeah, Prof, any thoughts of like
Okay.
what's the next step
Yeah.
after this?
If either HPV or PEP test is abnormal, then you need to go through another procedure. We call it colposcopy. Colposcopy is a test where we look at your cervix under magnification. It is a bit like doing a pap smear where we need to use the speculum to really look at your cervix, but we use camera with magnification to see in more detail the state of your cervix, whether there is any abnormal looking area, whether there is a lot of blood vessels, and if there is the case, then we will take biopsy, which means we take a sample of that tissue from your cervix, from the area that does not look normal, and send it to the lab. The lab will tell us whether it's just normal, is this a bit inflamed, or it will tell us that there is a pre-cancer state, or it can even tell us there seems to be already an early cancer state. So that's what you need to do. So if your test result comes back, the doctor will advise you to do that.
Thank you so much, Prof. Yeah, I think that's pretty important to know as well, like what the next steps are. Do you mind translating it as well into PM,
Okay.
or as well? We've covered so many questions. Any specific information that you find really important, you would like to translate for us? That'll
Okay,
be great.
sure. Yang pertama, kalau kita tak suka doktor buatkan kita punya pemeriksaan, Faraj untuk melihat cervix dan mengambil sampel untuk pap smear untuk HPV. Untuk HPV, kita boleh membuatnya sendiri. Dia ada test kit dan kita boleh ikut instruction, kita boleh ikut penerangan yang diberi dan kita ambil sendiri sampel. Dia melibatkan satu structure yang macam stick yang kecil, agak panjang dan masukkan ke dalam vagina dan kita akan ambilkan calitan. Dia akan suruh kita gerakkan kita punya sampler tu dan untuk dapatkan sel-sel daripada vagina, dan kita keluarkan balik dari vagina, masukkan balik dalam bekas dia dan hantar balik ke doktor, bagi ke doktor, dan dia akan hantar ke makmal. Jadi kalau tak suka doktor buatkan, boleh buatkan sendiri. Sepatutnya tak susah dan sepatutnya tak sakit lah. Sebab kita yang boleh adjust sendiri macam mana bila kita buat test tu, dan penerangan dia agak jelas untuk kita ikut, so selalunya tak salah. Okay, itu satu. Yang kedua, kalau test tu balik, tapi ini ialah untuk HPV saja. Kita tak boleh buat sendiri pap smear. Sebab pap smear ni memerlukan doktor tengok pangkal rahim tu, cervix tu, dan tengok tempat mana yang kita nak ambil sampel dengan spesifik. Sebab dia mesti nak sampel daripada satu bahagian yang cervix tu. Jadi tak boleh blindly masukkan dan harapkan untuk dapat sel daripada cervix. Tak boleh. Tapi HPV testing boleh buat sendiri. Sebab dia cuma perlukan sampel daripada vagina saja. So kita just masukkan alat untuk ambil sampel tu dan gerak-gerakkan dia dan keluarkan. Should be okay. Dan kita tunggu test result tu balik. Kalau test result tu balik sebagai normal, okay. HPV tak ada, jadi kita boleh ulang 5 tahun lagi. Kalau HPV test tu balik sebagai ada virus, dan virus ini ialah virus yang berisiko tinggi menyebabkan kanser, dan kita perlu melalui satu lagi test dipanggil colposcopy. Colposcopy ni ialah satu pemeriksaan di mana lebih kurang macam pap smear, doktor perlu masukkan alat untuk kita tengok cervix, dan kita gunakan kamera dan kanta yang besarkan magnification untuk kita tengok cervix tu dengan lebih jelas. Adakah dia mana-mana bahagian yang tak normal. Kalau kita nampak bahagian yang tak normal, kita akan ambil tisu isi daripada cervix tu, tisu dia, dan kita hantar ke makmal. Dan makmal akan bagi tahu tak ada apa-apa, atau ada proses inflamasi atau jangkitan, atau ada pra-kanser, atau kadang-kadang kanser yang awal. Jadi bergantung pada apa yang kita dapat, dan kita akan bincangkan treatment seterusnya lah. Okay, so ini untuk kedua-dua HPV virus dan pap smear yang tak normal. Then kita pergi ke colposcopy. Nama test dia adalah colposcopy kalau nak Google colposcopy.
All right, thank you so much, Prof. So we have another question here from Amira, and she asked, "I was wondering, I already took 2 doses, but I missed the third dose. Is my vaccination effective?"
Okay, so kalau if you're older than 15, then you have to take 3 doses. If you have missed the third dose, you can take it as you remember it. You don't have to repeat the whole thing all over. Okay.
All right, thank you, Prof. Really short and sweet answer. I love it. So the next question we have is from Huijun, which is, "Good day, Prof. There are a few vaccines for HPV in the market with different prices. Is the most expensive one better?" Yeah. I think that's is another reason why a lot of people, there was this misconception about pap smears versus vaccination, because there's a difference of price points as well. So yeah, would love
Okay.
to know your thoughts on this.
Okay. Offhand, I cannot remember the prices of the vaccine. Okay, but I'll tell you so far there are 3 types of vaccine. One is the one with only HPV 16 and 18, protection against HPV 16 and 18. And these 2 viruses actually cause about 70% of cervical cancer. So if you take this vaccine, you'll be protected against 70% of cancer. There's another 30% chance that you might still get cancer because the other viruses can infect you and cause cancer in you, but not these 2. The next vaccine protects you against 4 HPV types, which is 6, 11, 16, 18. So 16, 18 is the same, 70% cervical cancer. 6, 11 is the one that causes warts, genital warts. Okay, so if you take the one with 4 vaccine, you're protected against genital warts and 70% of cervical cancer. The third vaccine is called a nanovalent vaccine. It has got 9 protection against 9 HPV types. 6, 11, okay, the one that cause wart, and 7 HPV that cause cancer. Okay, let me see if I can remember. 6, 11 is the one. 16, 18, 31, 33, 45, 52, and 54. Okay, but there are a few other viruses that is not included in here. But these 7 viruses can protect you against 90%. So the higher the protection, the better. The higher the number of viruses, the higher protection that you get. Okay, you have to check the price. I can't remember the prices, but that is the principle. So I would say, rather than taking the bivalent or the quadrivalent, you take the nanovalent for better. This is what I give to my children, the nanovalent vaccine. Yeah. And I vaccinate my boys also, so that my future daughter-in-laws will be protected against cervical cancer.
Yeah, that is so sweet. Thank you so much, Prof. I mean, I think it's great information for people to know that you don't just vaccinate your daughters, but you can also vaccinate your sons as well, in order just to protect the people who they come in contact to as well.
Yeah.
I think that's a really great effort. Thank you so much, Prof. All right. So we have another question here from Karen, and who asks, "Doctor, do unmarried women with no sexual activity need to do pap smear too?"
You don't have to. You only need to take the HPV vaccine. And if ever you have sexual activity later on, then only you start your pap smear and HPV testing. But if you have no sexual activity, then there's very, very little chance that you are going to get the virus, and therefore you do not need to be tested for HPV, do not need to be tested for pap smear, or do not need to have pap smear done. Simple answer is no. The long answer was what I gave you.
All right, but you mentioned before that you also wanted to explain a little bit more about the HPV vaccine with
Yeah.
would you
Okay.
like to hear?
Okay. So we give vaccine to those who are not yet exposed. That is very clear, right? But there are people who said, okay, I've had sexual exposure, but I might not have the virus. Can I still take the vaccine? The answer is yes. How do you do it is, so you're sexually exposed, you come to your doctor and say, I want to test whether I have HPV virus already from my sexual exposure. So we'll do the test. if you do not yet have the virus and you are less than 45 years of age, you can take the vaccine. Okay, so that is one. Some people want to go a step further. I'm sexually exposed. I have the HPV testing. It shows that I have, say, one or two of the viruses that can cause cancer. But you know there are 14 other types, and you know the nanovalent vaccine has seven, can protect you against seven types. Can I still take the vaccine? Theoretically, yes, because now you're protecting yourself against the other virus that can also cause cancer. But I think you need quite a bit of discussion with your doctor to look at your personal risk. So I'm not generalizing to say, yes, even if you have the virus, you can take the vaccine, because we need to discuss a little bit more about that. But if you're only exposed, no virus, less than 45, go ahead and take the vaccine for your protection.
All right. Thank you, Prof. I think definitely any form of prevention is better than needing to cure later on. So
Yeah.
prevention is better. We have one more question from Fatzin Nadia, which is the nonavalent the one
No.
given to school children?
The one given to the school children is actually the bivalent, only the one with 16 and 18. The nanovalent has just come into the market a few years, and it's not yet in the school vaccination system.
All right. Does that mean that we should take our own initiative to, revaccinate our children as well with the nonavalent?
Right. There is not yet a consensus about that. I think it needs personal discussion whether you want to add on to the number of protection or the percentage of protection that you need. Theoretically, it sounds that's a reasonable thing to do.
All right, thank you so much, Prof. And thank you so much for the question. So now we have another question by Norbella here, which is, Hi, Prof. I wonder if women we can do pap smear, but how about the guy? What test do you suggest for men to detect HPV?
I don't have very good news for boys or for guys. There is, they're not as lucky as us. There is no test that we can do to detect HPV in them, because we don't know where to get the sample from. Although we know HPV infection in men can cause genital warts and some cancers also, rarely, penile cancer, anal cancer, even throat cancer. But to date, up to now, there is no guidelines to say what are the best ways to detect HPV in men. So it's a bit unfortunate. We just have to wait for the disease to appear, and then you can take a biopsy. So remember, we are very lucky in that sense because we can test it and know our status.
I think that's scary as well because, in a sense, a lot of men who may be carriers of it, we not know, and they will
Yeah,
just like pass it on to other people
yeah,
if they are sexually active as
that's
well.
right. That's right.
Yeah, so very important for both men and women to get vaccinated as well.
Yes.
All right. So thank you so much, Prof. I think that's all the time that we have today. So I think it's very important to get vaccinated as early as possible. And therefore, we are glad to introduce our HPV vaccination services in iMune Healthcare as well. So if you're interested in getting a HPV vaccination, please don't hesitate to contact us at our website. And the link will be provided in the comments as well. So thank you so much, Prof. Nazima. Now, before we end, what is the main thing that you want people to take away from today's session?
Yeah. A few things, not many. First, we are still not winning the battle against cervical cancer. And we can only win it if we do the right thing. So the things that you need to do is, one, get vaccinated. If you have missed the vaccination, you can get tested for HPV. If you're still negative for HPV, you can get vaccinated although you are past the school age. If you have HPV, or if you're not vaccinated, then you need regular HPV testing plus pap smear. The protocol is there, like what I mentioned before. Between the age of 21 to 29, just pap smear every 3 years. Between the age of 30 to 64, HPV and pap smear every 5 years. I'll repeat this in Bahasa Melayu.
Mm-hmm.
buat masa sekarang kita masih belum menang melawan cervical cancer kerana masih ramai wanita kita yang dijangkiti HPV virus yang mendapat kanser dan menyebabkan kematian. Jadi cara untuk kita menang melawan cervical cancer ialah satu, kita mengambil vaccination. Yang kedua, kita membuat test untuk mengetahui sama ada kita ada virus atau tidak. Dan kita membuat pap smear juga untuk mengetahui sama ada telah ada perubahan pada pangkal rahim yang menuju ke arah kanser. Yang ketiga, kalau kita didapati telah ada peringkat prakanser atau kanser awal, mesti dapatkan rawatan dengan cepat. So dengan cara ini, kita boleh mengurangkan risiko dan mengurangkan kebarangkalian wanita-wanita di Malaysia mendapat kanser cervix. Target kita ialah zero cervical cancer. Target kita ialah tidak ada wanita Malaysia yang mendapat cervical cancer di masa depan kalau kita boleh mengikuti protokol ni. 90% vaccination, 70% test dan 90% rawatan awal. That's the spirit we want to have.
Thank you so much, Prof. I really admire your spirit and your desire to get this information out there. And we are so thankful for you as well to help educate everyone here on cervical cancer and HPV vaccination and why it is so, so, so important to get vaccinated, both men and women. So yeah, thank you, Prof. Nazima, for your time and efforts. If we didn't manage to address your question, Prof. Nazima will be answering any unanswered questions in the comments after the talk. So feel free to continue to ask questions right now. So if you've enjoyed this live consultation, I